Hi, my name is Richard Shen, physical therapist at Torrance Memorial Medical Center. We're here today to talk about how to take care of your shoulder after rotator cuff surgery. We will go over precautions, putting on and positioning your sling, sleep position, taking a shirt on and off, and gentle exercises to prevent stiffness. There are two main goals after surgery. The first goal is to protect the repaired tendon. You can protect the repaired tendon by not actively moving your shoulder for 6 weeks. Active movement is also termed active range of motion, where the shoulder muscles and tendons activate to move the shoulder. There is no reaching out forward, no reaching out to the side, no pushing or pulling, or putting weight through your arm. This is very important the first 6 weeks to allow healing to occur and to minimize your pain. The second goal is to minimize stiffness in your shoulder. You're allowed to do passive range of motion, where you use an outside assistance to move the shoulder so the muscles and tendons stay relaxed. We will go over gentle exercises to minimize stiffness in the shoulder and arm. Your shoulder surgery is done with a nerve block, so you'll not feel any pain the first 24 hours. Once the nerve block wears off, it is normal for the shoulder to be painful. It is important to take your pain medication and ice regularly to stay on top of the pain. Some patients try not to take their pain medication, then their shoulder becomes too painful, they can't sleep, or do their exercises to minimize stiffness in the shoulder. If your pain is minimal after surgery, you can take an over-the-counter such as Tylenol, Advil, or Aleve as needed. At about the 4 to 6 week mark, your shoulder will start to feel better. Just because it feels better does not mean you can use it normally. We often see patients aggravate their shoulders at about this time because they assume they can use their shoulder more. Please talk to your therapist or your surgeon about what movements would be safe for you. We will next go over positioning and putting on your sling. If you've noticed, your sling has a pillow along the side. This pillow is called an abduction pillow. Research has shown that having your arm about 30 degrees from your side reduces the strain on the rotator cuff tendon. It is important to wear your sling for the first 4 to 6 weeks after surgery to minimize strain in the rotator cuff tendon, allow it to heal, and minimize pain in your shoulder. To put your sling on, you'll lean forward and let the surgical arm hang forward. Slide the arm into the sling. You should feel your arm at the bottom of the sling. If there is space between your arm and the sling, then the sling is too low. Pull the front strap up until your arm fully rests at the bottom of the sling. Make sure that your shoulder is not tilted forward or that your arm is on your stomach, but is comfortably resting at your side. It is normal to have difficulty sleeping after surgery. Most patients need to sleep in a recliner or in a reclined position. Taking your pain medication about 45 minutes prior to bed and icing will help. When you're sleeping at night, it is important to make sure that the shoulder does not extend back past your body. When the shoulder extends past your body, it tends to put strain on the rotator cuff tendon, creating pain. You need to make sure you put pillows underneath your arm to support the arm and make sure it's aligned with the body. Putting on a shirt. Typically, putting on a button-up shirt or a tank top is easier after surgery. To put on a button-up shirt, you'll lean forward, let the surgical arm hang, slide the surgical arm into the sleeve first, then wrap the shirt around and put the good arm into the sleeve. Showering. It is okay to shower after surgery, no bathing or swimming where the incisions are submerged in water. When you shower, try not to let the water run directly onto the incisions. If you want to wash your underarm, just lean forward and let the surgical arm hang. At about 7 to 10 days, you'll go to your first doctor's follow-up appointment. The doctor's office will remove the stitches and cover them with white strips. The white strips are very sticky. Do not try to remove them early. They will start to come off in about 1 to 3 weeks, and then you can gently peel them off. We'll next go over some exercises. The number one rule with exercises is no increasing pain or sharp pain while you're doing them. You should only feel gentle pressure, pulling discomfort. The exercises are to be done gently. Do not think the more aggressive you stretch your shoulder, the better you will be. You will only be in more pain. The first exercise we'll show you is the shoulder blade squeeze. What you will do is gently squeeze the shoulder blades back. Make sure you don't squeeze the shoulder blades up and shrug. You want to keep the neck relaxed and the shoulders down. You're going to hold that for about 5 seconds. Do 10 to 15, 3 to 4 times a day. Because your shoulder and arm is in a sling for 4 to 6 weeks, we'll show you gentle exercises to minimize stiffness in the elbow and wrist. For the elbow, you can gently just straighten and bend the elbow 10 to 15 times, 3 to 4 times a day. And do this slowly. For the wrist, you can bend the wrist back and up 10 to 15 times, 3 to 4 times a day. You can also do circles 10 to 15 times, 3 to 4 times a day. To maintain strength in your arm, you can take a small ball, have your arm about 90 degrees, and the shoulder gently back. You will gently squeeze the ball for about 5 seconds, relax, and do it 10 to 15 times, 3 to 4 times a day. Make sure you do not squeeze the ball so hard that it causes pain in the shoulder. We will next show you how to move your shoulder forward passively so the muscles and tendons stay relaxed. We'll show you 2 ways. Pick the way that feels the best to you. The first way is the counter rockback. You will rest your surgical arm on the counter. Keep your shoulder gently back. You'll then bend at your hips to gently rock back until you feel pulling, pressure, discomfort. Do not move into sharp pain or worsening pain. Sometimes having your arm at a slight angle out to the side while you do this feels better for the shoulder. You'll do this 7 to 10 times, 3 to 4 times a day. The second way is called the table slide. You'll sit at a table at comfortable height of your shoulder. You'll rest your surgical arm on the table with a towel underneath the arm. Use your good hand and place it underneath the surgical arm. You'll then use the good arm to help slide the surgical arm forward as you lean forward. Try to keep your shoulder gently back, bend forward at the hips. Again, sometimes having the arm at a slight angle out to the side feels better. Go until mild, moderate discomfort, no increase in pain. You'll do 7 to 10, 3 to 4 times a day.